Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, we welcome returning guest Charles Bacchi, who leads the California Association of Health Plans. The California Association of Health Plans and its members serve over 45 million Californians with health insurance and are almost insuring every single individual in the state. In today's episode, Charles talks about some of the efforts of the California Association of Health Plans to make that insurance for everyone a reality and how we're almost there. And we go into detail about their upcoming fall conference in October. At the conference in October, he touches on how leaders from the state, both from the government and not-for-profit and for-profit side, will be there, how they're expecting over 1,000 individuals, and some of the fun folks can expect to have at their conference. We hope you enjoyed today's episode with Charles and the California Association of Health Plans. Feel free to check out other episodes by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Hi, Charles. Thanks so much for joining the show.
Glad to be here, Gavin. It's good to see you again, and I look forward to seeing you here in a few weeks.
Yeah, definitely. And Charles is mentioning a few weeks because of their annual conference that he'll be talking about a little bit in today's episode. So, Charles, before we get to your organization and reminding the audience about the California Association for Health Plans, can you tell me a little bit about maybe something new about yourself, something different from last year?
Happy to. Again, Charles Bacchi. I'm the president and CEO of the California Association of Health Plans. I've been here representing the plans in California for about 18 years now. I think going on year 9 as being the leader of the association. And it is a challenging and fulfilling job every single year. Something people probably don't know about me outside of healthcare. People who know me long enough would know it. But prior to coming to work for CAHP, I didn't know anything about healthcare. A lot of people who are in the healthcare space are experts. They go to school for it. They're trained. I actually started off in the legislature working on education policy, and was my first kind of major accomplishment was helping negotiate at the time in 1998 the largest statewide school construction bond in California history. It was a bipartisan school construction bond. I think I was 28 years old. And I got to sit in meetings with the governor and the speaker and the pro tem and in the California legislature and government and basically negotiate a really complicated overhaul of the way the state builds schools. And part of that was balancing all of the interests of urban schools that were in decay and needed to be retrofitted, suburban schools that were growing because there was new development, and a school construction office that had basically was dysfunctional. And so nobody could build a school in the state of California. And that bipartisan deal passed the voters, and it sort of ushered in what is now the modern way of building schools in the state of California. And so my kids are both in high school. I travel around to high schools all the time. I spend a lot of time in gyms and at pools. And anything built after 1998, I just look around and think about, the work that we did back then. There's been many bonds since then and changes to the program, but that really started the modern era of school building here in California. What I kind of took away from it was that in order to get something really big accomplished, you have to find common ground among constituencies and groups that sometimes have trouble finding the common ground themselves. And you've got to be able to find and reach consensus between people who have very different viewpoints. If you're in an inner city and you don't have air conditioning or your air conditioner's been broke for 10 years, you don't have any new developers coming in to develop and generate revenue. You need help with your air conditioner. But if you're out in a field somewhere where there's 30,000 homes being built, you need a brand new school right away. And so trying to come up with balancing all of that is was a lot of fun, and a lot of people don't know about it. And thank you for letting me go on about it for probably longer on a healthcare podcast than any of your readers and listeners would want to hear about.
Well, there is a connection because we all have been educated, whether here in the U.S. or elsewhere. If our audience is 99% healthcare professionals, and they've all been educated somewhere. So I will say there is a connection. So well done. My wife is also a teacher. And so her school, I think, was built before that bill was developed and your efforts were completed. But it definitely resonates for me. You mentioned you've been in many gyms and pools. So do your kids, are they in sports? Or tell us about that.
Yeah, I've got a varsity volleyball player. She's a senior. She's in her third year in varsity, and they went to states last year. They lost. At a beautiful gym in Fresno that was built with the money from that school bond, by the way. And then my youngest is a swimmer, and so she spends a lot of time at competitive swim meets up and down California. So,
okay, awesome. Well, I would hate to be the host of one of your kids' events because I know you'd be there and just teasing. Yeah. Well, let's jump into healthcare and a little bit about your organization now, Charles. Charles is a returning guest. Some of you may have seen or listened to his episode last year, and we try to time it right before the annual conference. So, Charles, can you give me a quick reminder or a quick reminder to our audience about what your organization is, maybe who some of your partners are, and then maybe spend a few minutes talking about some of your initiatives this year before we jump into the conference?
Yeah, absolutely. Again, thank you for having me, Gavin, if I didn't say it during the first segment. CAHP is a state-based trade organization representing all of the major health plans in the state of California that do commercial coverage for employers, for individuals who buy coverage on their own, and also who hold Medi-Cal contracts to provide Medi-Cal coverage to the state of California. All told, our plans provide coverage to over 45 million Californians. It's a huge state, and we are really proud of the work that we do, but there's always challenges. So we have public plans, which are our local initiatives. We have commercial plans, and we have California's giant non-for-profits like Kaiser Health Plan. And our big initiatives, this year and most years is really trying to explain to the policymakers at the state capitol, as well as the public, the value that health plans bring to our healthcare system. The fact that we organize care, the fact that we are instilling quality in the coverage that people and the care that they receive, and that we're providing policies that not only are affordable, but also, not only high quality, but are also affordable, which is a huge emphasis for our members. In order for people to access healthcare, it has to be affordable. They have to be able to buy it. And for those who can't buy it and need assistance through the government in the Medi-Cal program, we need to be able to deliver quality care that's affordable to the state of California. So we always have an eye towards making sure that we're delivering the best care possible in the most efficient and cost-effective manner. And because of all of that, the other theme that kind of arches our work is that, we need to improve our healthcare system. And we need to all be working together to do that, but we don't need to tear it down. And there's some folks out there who want to kind of erase the current healthcare system and start all over again. And we think with the progress that we've made in California, and we've made in the United States, that actually we're real close to having exactly what we need, which is first of all everybody being covered. And in California, we are so close. It's infinitesimal, the amount of people who don't have access to healthcare in California now, and we need to get across that final finish line.
Yeah, that's a really good point. And I think if I may take a guess at kind of what you're alluding to there, the Medi-Cal plans, right? There have been some gaps in the past of certain ages of individuals who may not have Medi-Cal coverage. And so some of those have been closed. Which is really neat and very generous of our state. We live in a very generous, giving state, so it's really neat. And I applaud your members, or your members who are helping their members get that coverage. So let's talk a little bit about the upcoming conference. Tell us about how long you guys have been doing it, where it is, and maybe some of the headline sessions.
Sure. Our keynote sessions is a 2-day conference. Will be focused on the first day on kind of the views about the workplace that people have in different generations, what makes them happy in the workplace. It's a topic that we've done, I think we did about a decade ago, but I think what's the new wrinkle this year is remote work and how generations also are looking at remote work as a positive and negative and how they see it fitting into what makes them fulfilled as employees. So I think that's going to be a lot of fun on day one. And on day two, our keynote will be talking about artificial intelligence, but I've instructed him to cut through the hype so that we don't hear, these fanciful stories about how AI is going to save the world or it's going to destroy humanity, that we actually talk about what it can really do in healthcare and what it can't. And then it's, as usual, I know you've been to our conference before, it's a who's who of California healthcare leaders. We've got the state Medicaid director, the director of our state-based exchange, our Office of Affordability will be there, our chief regulator, plus health plan CEOs, executives, medical directors, and they're all going to be talking about the topics that people want to hear about. What's happening with Medi-Cal redeterminations? What is California doing to make sure people keep their coverage either in Medi-Cal or on the state-based exchange? We have a new managed care contract for Medi-Cal in 2024 that is a massive paradigm shift for managed care plans. So we'll be talking about that, talking about the No Surprises Act, obesity, behavioral health. We have a new affordability office that's going to be setting cost targets for the state of California, and so they'll be presenting their latest work. So it's going to be a really great 2 days of rich topics that I think a lot of people will find value.
Yeah, I would agree. Those are some great topics. You mentioned the 2024 change in which managed care organizations are covering which counties. So I think updates there for me will be of interest. I'll be attending as well. Had a great time last year. I think you guys had, you'd mentioned, or Margie, your colleague, had mentioned over 1,000 folks there. So like you said, it was a who's who. Hotel's really nice too. So you guys actually pick the desert. Tell us about that choice.
We are too big for most hotels. Last year we had about 1,100 people. We think we're going to break that this year. And so we're actually kind of getting too big for our, we're kind of on the edge of moving into convention centers.
Okay.
And, that's just a feel that I don't like. It's great. I'm in a big convention center with 5 other conferences, but we really want this to feel like people are coming to a destination and that destination is beautiful. And they get to be with people that they want to be with. And have an experience, and I think that this location works. And while it's hard to get to sometimes out in Palm Desert, in Palm Springs, California, it's unique. It's a very unique location. It's a very unique place, very unique venue. And I think it really allows people to, work, but also let their hair down and socialize while getting work done. So.
Yes, I definitely saw some very well-known leaders let their hair down last year. I won't name names, but it was pretty cool. I used to be a young healthcare professional, and I remember going to these events and just being intimidated, by all these leaders. But I've come to learn that we're all the same. So whether I was I shouldn't have been intimidated or stressed. So now I know you mentioned you might break that amount this year. I know like for exhibitors, for example, there was very limited space. Is there still, like, if people are hearing this for the first time, whether as an attendee or maybe an organization that works with the health plans or wants to work with the health plans, is there still space? And if so, how do people sign up?
Yeah, well, our exhibit hall sold out over a month ago, so it went pretty fast. We may still have some other sponsorships available. Check out our website, www.calhealthplans.org, and you'll find a link to our conference there. Marjorie King on our staff is helping lead all of the logistics around the conference, and she can help with sponsorships. We are still taking registrations. The hotel is nearly sold out. We've taken down more rooms. We're looking at having to get an overflow book of rooms too. But registration will be open right up until the day of the conference. And we encourage people, if you want to attend, to get your registration filled out and submit it, and make sure you can get a room somewhere nearby.
Yeah, definitely. You mentioned the exhibit hall sold out, which is great. That exhibit hall was probably one of the best I'd seen. And a quick shout out, I don't remember who the company was, but for those of you who may not attend a bunch of conferences, or it's been a while, there was a booth that did professional headshots for anybody. And I'd never seen that before. And my professional headshot was taken at your conference. There's no logo. What's great is there's no logo of the organization. That's blasted on there. So it was great. And
they're going to be back this year. It was super popular. I know you loved it. Other people loved it. I was probably the only person who didn't get their headshot taken because the line was so long and I had to be so many different places. But aspirationally, I'm hoping this year that I can get it, because they looked fantastic, way better than the headshots on our website. So it's a fan favorite, and it's back again. So.
Yeah, I think they gave me like 20 to pick from. I mean, they didn't like just make me sit down for 10 seconds. Like, they gave me a good 2-3 minutes. It was really well done. And that was definitely the longest line. Also, I know there's a significant number of giveaways that can also be donated for folks who may not be able to accept, raffle prizes, things like that. So it was a great conference. I spent most of my time, we were an exhibitor as well. And we had a great spot right by some of the appetizers. Food was great. So I encourage you folks, especially if you're new in California to the healthcare world, if you work with health plans already, or whether you don't, this is a great place to learn. And the networking was fantastic. Like you said, people let their hair down. A lot of hands shaked or shook. I don't even know how to say that correctly.
I know. Well, it's nice to be shaking hands again. Because the year before we came out of the pandemic and held a conference. We were one of the first conferences in California to roll out during that kind of that wobble year. Where like we were open, we were shut. We were open, we were shut. And so it was great last year to have people feel more comfortable about, shaking hands and hugging, which again, late enough in the night, there's too much of that probably happening too. But I think we're timed well, because right now there's a COVID surge in California, which should be over just in time for our conference. So we're keeping our fingers crossed, right?
Yeah, absolutely. Well, again, Charles, can you give the website one more time to find out more information about your organization and the conference? Yeah,
it's www.calhealthplans.org. So CAL healthplans with an S.org.
Awesome. Thanks, Charles. And you mentioned your colleague, Marjorie, who helps put together the conference. I've had a chance to work with her over the last year and a half, and her speed of communication and just being on the ball is pretty neat. I think she's been there quite a long time, and I can see why. So
yeah, she's fantastic. Thank you for the positive feedback. She's a great team member, and we're just really excited for this year's conference, and I think it's going to be a good one.
Awesome. Well, Charles, thanks again for joining the show. Look forward to seeing you in a few weeks. And folks, take care. Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.